Hello, everybody. Welcome to the Intentional Aging discussion for October 2022. My name is Karina, and I am a librarian with the North Olympic Library System here in Qualam County, Washington. We also have Ellen with us today. She's a public services specialist here at Knowles, and she's working behind the scenes to handle technical aspects of our Zoom get-together and watching the chat and all that good stuff. So thank you for being here, Ellen. I would like to begin by acknowledging that the lands on which we live and gather are the appropriated homelands of the indigenous peoples. We want to express our deepest respect to those peoples, past and present, including the Hoh tribe, Jamestown Slalom tribe, Lower Elwha Qualam tribe, Makah Indian tribe, Quileute tribe, Quinault Indian Nation, Port Gamble Slalom tribe, and the Skokomish tribe for their care of these lands throughout the generations. Let us learn more about the histories, cultures, and traditions of Indigenous peoples, and let us strengthen relationships with sovereign tribal nations to provide an inclusive space fostering innovation and collaboration at the library. For those of you who are joining us for the first time, I would like to provide a brief overview of the Intentional Aging series. This program is intended as a safe and inclusive space where adults can explore and discuss topics related to aging. I do not claim to be an authority on the topics that we discuss. I am exploring these topics and learning new information right along with all of you. My purpose here is to share information and resources that can guide us as we explore. Sometimes we have guest presenters with special knowledge related to that month's theme. We also do activities, have book discussions like we will today, and engage in conversation. The hope is that these gatherings will help you connect with each other and gain some insight into the ways in which we can influence our own quality of life now and live the life we choose for as long as possible in the future. We have set this program up so that when you register for one session, you are automatically registered for all future sessions. This serves two purposes. One, you do not have to register over and over. And two, it allows us to use this same Zoom link for every session. The vision for this program is that you can plan to either attend all of the events, or you can pick and choose among the events based upon your interest in the topic. There's no need to cancel or notify me if you plan on skipping an event. We'll just be thrilled to see you whenever you can join us. Everyone who is registered will receive intentional aging emails from me. I typically send out an email a few days before each session to provide the Zoom link again and remind you that it's coming up. I also send an email about 1 week after each session to share the links to articles and titles and resources mentioned in the presentations, along with a link to that recording that we talked about when there is one. If you ever decide that you no longer wish to attend the session or no longer wish to receive those emails, all you have to do is send me an email requesting that I remove you from the list. It's as simple as that. During most of our gatherings, we provide some time to share a bit about what is going on in everyone's life. So please know that this is absolutely voluntary. The activity we typically engage in is called Rose, Bud, and Thorn. Depending upon the number of participants and the amount of time available, we might do this within the entire group, or we might utilize breakout rooms available on the Zoom platform to do the activity in small groups. And I'm kind of feeling we have 19 of us here today, and we kind of have some room to play with in our time frame. So I'm kind of thinking we're just gonna do the large group thing, especially it's kind of fun with some new faces. We all can, if any of the new folks want to chime in, we can all have a chance to meet each other. So today we're going to stay together as the one group. In this activity, everyone will have the chance to share a rose, a bud, and a thorn. So a rose is something positive that you've recently experienced. A bud is something new that you're excited about or looking forward to learning more about. And then a thorn is something difficult that is on your mind, something weighing on you that you might want to just share. These can be small, simple things. For me, a rose today is that I actually unloaded and then loaded the dishwasher before I even went to work today. And that just makes me so happy. But it can also be bigger, more challenging issues that you're facing. What you choose to share is completely up to you. If you'd rather not share at all, that is absolutely fine too. You can just sit and listen. Please remember to respect everyone's privacy and only share what is discussed when permission has been given by the person who originally shared it. We want everyone to feel safe, seen, and heard, and to keep within the spirit of protecting privacy. This portion of our session will not be included in the recording. So Ellen, if you will, go ahead and stop recording. Thank you, Ellen. All right, now I gotta get that window to go. Here we go. Okay, so my apologies for forgetting to unshare my screen, but the good news is that means it's already shared and I don't have to do it again. So welcome to our October presentation. I hope everyone who wanted to share had a chance to do so. Today we are exploring advanced care planning and end-of-life choices. We will first take a look at advanced care planning, and from there we'll move into a discussion of the ideas presented in our Last Best Act, the book by Mallory McDuff that was available through the library this past month. I want to let you all know that I will, as I mentioned earlier, send you all an email early next week, which will contain links and titles for all the resources that will be mentioned here today. So feel free to jot down notes, but don't worry if you think you missed something because I will be sending it all to your inbox. So what is advanced care planning? Well, it is a phrase that refers to making decisions in advance that can ensure that our wishes and our preferences are reflected in our healthcare treatments if for some reason we are unable to communicate those preferences ourselves. So basically, advanced care planning is planning for the care we want to receive, even if we can't ask for that. Many people think,
can you talk closer to the microphone? You're kind of fading in and out.
Sure. Uh-oh, that's not good. All right, I will lean in. Okay. Uh-oh, what if I can't read now? Too close. Okay, so many people believe, is that better? Is that, I know sometimes that happens here in the copy room. I hope it passes.
It's sounding better to me.
Okay, good. Many people feel advanced care planning is important only for people who are older or people who have a serious illness. But people in generally good health can suddenly have an accident or an unexpected emergency that can put them in a difficult situation where they aren't able to communicate treatment choices. It could happen to any one of us. Thinking about this is not pleasant by any means, but a lack of advanced care planning can result in questions, confusion, or disagreement among those close to us if they are forced to try to guess what we would choose for ourselves. So creating an advanced care plan can prevent those close to us from forever wondering if they made the right decisions on our behalf. We might not ever face a medical situation where we are unable to speak for ourselves, but if we do, advanced care planning can truly be a gift. reducing stress and anxiety for ourselves and for those who care about us. Creating an advanced care plan can feel overwhelming and even a little unsettling. The process can be simplified a bit if we focus on two general categories: our health concerns and our values. When thinking about health concerns, it is helpful to start by considering any health conditions you are currently managing. In addition to that, family history can provide clues about possible future health issues. A conversation with your doctor can shed light on the types of decisions that might arise in connection with these health issues. Advanced care planning discussions with your physician are free through Medicare as long as they take place during the annual wellness visit. So that's a good thing to know. And many private health insurance policies also provide for advanced care planning discussions as well. And then the other thing to consider are your personal values. Along with health concerns, we can decide, what do we value? What do we feel makes life meaningful? Does quality of life matter? Or are we more concerned with living as long as possible? Some people wish to live as long as they can, or long enough to be part of an important event like an upcoming family wedding. I had a grandmother who was determined to be at one of her grandchildren's weddings, and she made it. And not long after, then we had to say goodbye because she got to be there. Sometimes it's something like that. That's the goal. Other people have a clear idea about conditions under which they would not want to prolong their life. An advance directive can be helpful in both of these scenarios. Oops. So the U.S. Department of Veterans Affairs has created this worksheet that can help you define what you value in life. A lot of us have a good idea, but when it comes down to putting something on paper, it can be kind of like, I know what I value, but what do I value? This worksheet lists various factors that affect quality of life and allows you to rate each of them on a scale of 0 to 4, with 0 meaning not important and 4 meaning very important. And then the worksheet also poses some yes and no questions about various medical treatments. As you consider an advanced care plan, it is important and helpful to have conversations with your doctors and the people close to you about what you would want in the event of a life-threatening illness or injury that leaves you unable to communicate. These conversations can help you decide what you want to include in your advanced care plan. Talking about your beliefs and values with your doctors and your loved ones' support can help you define your healthcare wishes. Having these discussions can be a little awkward. Take the opportunity when you can to start a discussion when a related topic pops up in conversations about movies or books or current events. It can also be a topic that you bring up in relation to telling someone about your recent visit to the doctor or a memorial service. Look for those organic moments, and it helps it feel a little less awkward. Once you have a sense of your future care wishes, you will want to take steps to ensure that they are communicated and honored. And the best way to do this is to create an advance directive. An advance directive is a legal document that guides decisions about your care if you are not able to make those decisions for yourself. It helps your doctors and loved ones understand your wishes for your health care. A lawyer isn't required to create an advance directive, but a lawyer can be helpful. Just know that if you do decide to use a lawyer, Don't rely on the lawyer to be able to help you understand different medical treatments. That is a conversation that is best to have with your doctor. So there are two types of advance directives in the state of Washington. The healthcare directive, which details your treatment wishes, and the durable power of attorney for healthcare, which names someone as your healthcare agent. So let's first talk about the healthcare directive. This is also known as a living will. It's a written document that tells doctors about the treatments you do or do not wish to receive in a situation where you are unable to communicate your own choices about your treatment. With a healthcare directive, you can say which procedures you would want, which procedures you would not want, and under which conditions each of your choices applies. Some of the treatments and procedures that come up in this phase of planning include CPR, ventilator use, tube feeding, IV fluids, and comfort management care. It can be helpful to discuss these, obviously, with your doctor. And then the other part of the advance directive is the durable power of attorney for healthcare. This legal document names your healthcare agent, also sometimes called a proxy, a representative, or a surrogate. This is the person you have chosen to speak for you and make decisions on your behalf if you are unable to do those things for yourself. The healthcare agent will not be responsible for your medical bills. They will only be responsible for advocating on your behalf. You get to decide how much authority your agent has over your medical care and whether they are authorized to make a wide range of decisions or only a few specific choices. Obviously, your healthcare agent should be someone you trust, who understands your wishes and will strive to honor them. This person might be a friend, your lawyer, someone in your social or spiritual community. You might choose your spouse, an adult child, another family member, friend, or neighbor. It should be a person who is familiar with your values and your wishes so they can truly advocate for you. It is good to consider also naming an alternate agent in case the person chosen cannot serve in the role when needed. Then be sure to have a conversation with the people you choose as your healthcare agent and your alternate before you name them in your advance directive, because you will want to be sure that they are comfortable with this responsibility. For any of us who feel reluctant to put specific health decisions into a healthcare directive or a living will, naming a healthcare agent is really important. In this case, the named agent will agree to evaluate each situation or treatment option independently and make decisions according to their knowledge of your values and your wishes. So this is still really helpful, even if you decide not to detail treatment wishes in a living will. There are a few stipulations that must be met in the selection of a healthcare agent. They must be at least 18 years old, and they cannot be your healthcare provider, an employee of your healthcare provider, or affiliated with any care facility unless they are also your spouse, your parent, your adult child, sibling, or another relative. Trust is the most important thing to consider. Who do you feel comfortable discussing your wishes with? Who do you trust to advocate for you? And who will follow your wishes even if they do not agree with them? There are additional documents that can be added to your advance directive. These can address specific medical issues and these are especially helpful for treatments that your doctor has suggested might be needed in the future. So I have listed here some examples of documents that address common emergency medical issues. First is a do not resuscitate order, also known as the DNR, sometimes also called a do not attempt resuscitation, a DNAR or DNAR, or an allow natural death order. A DNR basically tells medical staff in a hospital or nursing facility that you do not want them to attempt to return your heart to a normal rhythm if it stops or is beating unsustainably using CPR or other life support measures. Without a DNR order, medical staff will make every effort to restore your breathing and restore a normal rhythm to your heart. Similar to a DNR is a do not intubate order, a DNI, which tells medical staff in a hospital or nursing facility that you do not want to be put on a breathing machine. Organ and tissue donation is something to consider. Your wishes regarding organ and tissue donation can be outlined in either your healthcare directive or in a supplemental document. Informing your proxy, your family, and friends of your wishes will help them be ready to respond if medical staff approach the subject with them. And another thing to keep in mind, if you choose to be an organ or tissue donor and you request a DNR order, you will want to ensure that the DNR indicates that your wish to donate supersedes the DNR, because it is sometimes necessary to keep the heart beating until the organ can be used. So just something to think about. And then the physician orders for life-sustaining treatment, also known as a POST. It's a written medical order from a physician, a nurse practitioner, or a physician assistant that is used to communicate medical care decisions to healthcare providers and emergency responders. A POST is typically created when a person is critically ill or nearing the end of life. And this is the point when a healthcare provider is likely to know or have a really good idea of the specific decisions that might need to be made on your behalf. This form serves as a medical order in addition to your advance directive and allows you to provide guidance that healthcare professionals can act on immediately in an emergency. Your healthcare provider completes a POST after discussing your wishes with you, and once signed by your healthcare provider, this form has the same authority as any other medical order. The POST was created to help people facing life-threatening illnesses or life-limiting conditions make sure that in a medical emergency, healthcare providers would know and follow their treatment orders no matter where the emergency happens, whether it's at home or in a hospital or a nursing facility. Washington provides two options for validating your advance directive. You can either sign it with two witnesses of your choosing, or you can go and sign it in the presence of a notary. Once you've completed your advance directive and any supplemental documents you decide to add, be sure to provide copies to your healthcare agent, your healthcare providers, your hospital, and any other people that you think should have that information. Make a note on the copies about where the original can be found. Some states have registries that will store your advance directives so it may be quickly and easily accessed by healthcare providers, your proxy, or anyone else to whom you have given permission. Washington State, however, no longer offers an advance directive registry. They used to, and they maintain it, but only for those who registered their directive before July 1st, 2011. The webpage for the state registry now refers visitors to a national registry, which is available for a fee at usacpr.com. To give you an idea of a typical fee, this registry is currently offering a lifetime membership for $49.95. which is a special they're running through the end of the year. I don't want to sound like I am doing a commercial for them. I'm not endorsing them. I just wanted to give you an idea of what the fee might be. But that is a lifetime fee, so it could be worse. If you split your time among multiple states, like a lot of people do, you might want to consider preparing an advance directive using each state's approved form. Every state has a form that it approves, and it can simplify things. So if you like to winter somewhere sunny with no rain, you might want to look into the advance directive in that state. It could be a good idea. Your advance directive can be changed or revoked anytime you choose, as long as you are able to communicate that preference. Keep a list of everyone who was given a copy so that out-of-date documents can be replaced. If you store your advance directive in a registry and later make changes to it, obviously you'll want to be sure that the registry has the most recent version of your directive. It is good to review your advance directive at least once every 10 years. Changes in your health or your situation might necessitate updates more often, such as if you marry or divorce, if you lose a spouse or partner, if something happens to your proxy or your alternate proxy, or if you experience a big change in your health. And also, your wishes at age 40 may not reflect your wishes at age 60. They're likely to evolve as your perspective on life evolves, and an advance directive allows you to provide instructions for future care and then to change those instructions as your viewpoint changes. So, how is our care handled if we cannot speak for ourselves and we do not have an advance directive in place? Washington state law outlines an order for determining the decision makers for those who have neither a healthcare directive nor a durable power of attorney for healthcare. First in line is the patient's spouse or state registered domestic partner. If no spouse or partner exists, then adult children are given decision-making authority. If there are no adult children, authority goes to the patient's parents. If parents are no longer living, siblings are placed in charge. And then beyond that, it filters down to grandchildren, nieces and nephews, aunts and uncles. When more than one person exists at the applicable decision-making level, all of those people must agree on the healthcare decision, which can be tricky. If no one exists at any level, healthcare providers may require legal action to name a court-appointed decision maker. Each of these scenarios can delay decisions and prolong or intensify healthcare treatment, so it's not the ideal. Okay, well, we've been wading through some rather heavy material so far today. Planning for medical treatments in a situation where you are unable to communicate your wishes is not lighthearted fare. So let's lighten things up a bit by exploring some options for handling our remains when our time on Earth comes to an end. Oh, what a party this is, right? Several of you were able to take a look at this book over the past month, Our Last Best Act by Mallory McDuff. Copies are still available. They will be available if anyone didn't get a chance to look at it and decides after today's conversation that they're intrigued. This book chronicles a year in which the author explored the newer and more sustainable practices that are available for end-of-life decisions. It's a way, as her book cover says, of aligning your end-of-life decisions with your values. So a lot of it looks at the effects of various burial practices, the effects that they have on the earth and on the climate. which is on a lot of our minds, as we've mentioned, with these sunny days continuing into the latter half of October. So at this point, I would love to hear what you all thought, what stood out. I know the author provided a little background, or a pretty in-depth background for parents who are active, earth-conscious people, love to hike and cycle and garden and do things together. And then the author's mother was hit by a car while cycling at the age of 58, which inspired the author's father to get his wishes for his burial and his memorial service in place so that things would be handled in the way that he wished. And a lot of those decisions would be taken off of his children because he laid it all out there. And then, shockingly, 2 years after their mother died after being hit by a car while bicycling, the author's father died after being hit by a car while bicycling. So all of this influenced Mallory McDuff's decision to devote a year to exploring the options that are available for end-of-life planning. We all are familiar with conventional burial. The body is embalmed and placed in a casket, which is then placed in a concrete vault underground, which all has a cost financially, but also to the environment. And the book looks into that, and the book looks at other options. So at this point, I'm going to take a drink of water and give you all a break from the sound of my voice. And I would love to hear if anyone out there, did you learn of a new way to deal with remains that you weren't aware of? Maybe, or did you have your mind changed? Did you have a plan in place and then read this and thought, oh, you know what? I think I like that. Or were you more determined after reading some of these alternative ways to stick with your original plan? Whatever you'd like to share. Who would like to start us off? Cindy, are you waving your hand?
Yes, I am.
Hi.
Hi. Yeah, actually I just picked up the book a couple of days ago, so I have not read it. I'm just kind of glancing through it, but this topic has actually been kind of on my husband's and I's mind. A good friend of ours passed away around Thanksgiving, and he and his wife had already planned on having their bodies composted. And there's a company over, I think in Kirkland, it's called Recompose. And they had a really nice ceremony. They basically, I know it sounds a little weird, but they do compost your body. It takes about 30 days. I know sounds like you've heard of it. But I mean,
you'll learn more in this book.
Yeah, so it was kind of, sort of, wow, okay, that's an interesting idea. And being a farmer myself, it was like, oh, compost, yeah. But this is more, it's technically done. The ceremony was really thoughtfully done. It was great. I still have a little bit of soil from him. The soil then gets you can request people can get some of that to do with what they want to, as far as, a ceremony or whatever. Or it gets donated to a Bell Mountain is what they're doing now, Recompose is. So anyway, and it gets spread around with plants and trees and gets returned to the earth, basically. So that made my husband and I think about that too. And at first we were, it was going to be cremation. And then when we saw the side-by-side environmental impacts, comparing cremation to this, and it was like, oh wow, okay. So we're in the process anyway of signing up for that and making that a case. So it's a lot of people are like, what? So we're sort of getting it out there as far as the information, and people can look it up, Recompose, and decide for themselves, but it's definitely something that's got us thinking about it. So I think it'll be more popular as time goes on. And anyway, that's my story.
Thank you, Cindy. That's fascinating. Yes, I know. I was thinking cremation too. And then this book talks about 250 to 350 pounds of carbon dioxide to cremate one body, which is equivalent to a 1,000-mile car trip. That's got an effect. Evelyn.
Yes, I've been I've been interested in the idea of composting my own body since I saw something on the news one day about it, and then I recently saw an obituary in the PDN here where the deceased was composted, although I think my mind seems to remember Bellevue as the place, but there could be one in Kirkland too. I haven't gotten very far into the book either, but I've been thinking about my end of life a little bit more since I turned 70. It may seem young to some folks here on the call, but my mom only made it to 79. And actually I beat my dad by 10 years. So so it's something that I'm really thinking about a lot lately. You know, I don't have any major health problems that I know of. But with COVID, you don't know. And so it's yes, I definitely intend to finish this book before I take it back. It's a very good book so far.
I'm glad you're enjoying the book, Evelyn. I agree. I think it's really well written. And yeah, COVID has gotten a lot of us to start thinking realistically about these issues, maybe sooner than we would have otherwise. Okay, let's see, Elizabeth.
Right. I really enjoyed this book, and it really helped me have a shift in my way of thinking about burials. I work in a hospice as a social worker, and so I'm the person that often hands out the list of funeral home opportunities in our area. And it just seems so static. You know, there's a real static quality to it. And what I liked in the book was the relationships that the author had towards her parents and to her own children, and her concern about how they, you know, how they wanted their death, or their funeral, and how her children would carry out her wishes. There was just something really more flowing and organic and not static that I really picked up and excited me. A bummer, though, in my mind, is the cost involved. I mean, I work with a lot of people where just the cost of the most simplest cremation is a hardship. And it seems like a lot of these alternative burial ways are really expensive. I've looked at like Recompose, I think is more, pretty expensive. Maybe I'm wrong, but there's like this meadow where you can get buried in, I don't know if it's Snohomish County. I mean, these things look really fun, and I'm excited about these ideas, but the cost, I think, really turns me off. And I wish that we had we had an alternative that was just was cheaper than, that a green, simple burial was cheap and easy and not such a hardship and burden.
I love your description of that, Elizabeth, the static versus the more flowing. That was very, very powerful there. Thank you for sharing that. All right, Laura B., I think you are next in line.
Hi. Yeah, I really enjoyed the book. I had no idea. I thought that cremation was like good for the planet or something. I had no idea how awful it is. But yeah, the cost is a factor. But but it just I had a question that I did some Googling, but not very successfully. It seemed like there was a place to do this on the Olympic Peninsula, but I couldn't track it down exactly like where it is, because I'd like to go visit it, see what kind of place. And another thing I found in the book was that people who do this, like I didn't grow up on a farm. I've been to like 3 funerals in my life, and asking my kids to like load up the body and in the back of a truck and take it to the to the place. But she said stuff like, well, you can ask the funeral director to do as much or as little as you want. And they were trying to save money, I guess, to like just take it themselves. And they were, I guess, farm folk or whatever, but live in more nature than I do. And, not having an very big extended family, like you learn how to do that growing up as a kid by watching your aunts and uncles and parents, go to grandparents and stuff. But our family we didn't really do much of that, and kind of kept it from the children instead of having the kids right there and all that stuff for the funeral. So I like the book. I recommend the book. I need to read it again because it was a lot of new ideas and kind of scary to think about my mortality, but it seems like much kinder and gentler to my kids to like have decisions made or wishes that would give them some guidance instead of bam, handle it. Thanks.
Thank you, Laura. I know I tried to look into like a conservation cemetery and where they were in Washington State, because in the book she mentions that Washington State has some. And in true internet fashion, I may have seen what you saw. It made it look like there's one right in Swim. And then when I clicked on it, things got really vague from there. And it's just a way they try to hook you in, which we're going to address next month, but more on that later. So I'm still doing some digging there, and I hope to learn some factual information about what is available out here before I email you all next week. Did you want to add something, Laura?
Yeah, I remember in a previous intentional aging class or whatever that a person at the hospital whose last name is Ulf, I think, talked people through this, and I forget how to go about contacting her. I don't even know her first name or her title, but I thought if she's still doing it.
I do agree with the advanced care planning kind of stuff.
Yeah, I think
yeah,
so.
I'm going to touch on that a little bit later, but yeah,
Okay.
Olympic Medical Center does offer consultations. Last I heard, they lost their full-time position and it's being run by a part-time position. So things are moving a little more slowly than they used to. So you have to be patient. But yeah, I am going to provide you some information about that later on this morning. So, okay, Jane, I believe you were next in line. We got lots of time, everybody. You'll all get to talk.
I haven't read the book yet, but I intend to. I've just been out of town off and on the last couple of months. So it's interesting to hear the conversation. I was not aware that people were really doing the composting. The last 30 years I lived in Pennsylvania, and I know that it was near Philadelphia where they did some scientific experiments with bodies, and that must have been how it started. So they could see what happened if you just laid the bodies out on the ground. And they were respectful, and I've had friends who've donated their bodies for parts, skin and sinew, and there's just so many wonderful ways you can help other people. So I have that. But the last 30 years of my father's life, he wrote and edited and updated my parents' directives. So we always knew what they wanted. And it was very easy because we all had copies. And it was really a big help. I've seen families dissolve over keeping them alive, hooking them up to a heart monitor and that sort of thing. And that I certainly don't want. I'm glad to hear that maybe composting is allowed, and I'll have to look into the cost of that. It depends, especially in the East, I think. I was born in Washington. I'm glad I'm back. The funeral homes have a lock in many states on what you're allowed, the concrete vault but I know cardboard is allowed. The Amish make pine coffins. You don't have to spend $4,000 on a coffin. It's not going to protect you anymore. So I had thought of cremation. And that's what my parents planned. And that's what we had for my husband. And I kept his ashes for quite a while until I could get back out here. And we scattered them without asking permission. I have a friend whose husband was a pharmacist, and she put his ashes in different prescription bottles and had a service for him and asked people to take a bottle. And when they went on a trip that they really enjoyed, if they would scatter his ashes. And she still and let her know. So she's still getting reports, and that has pleased her. And I don't think he minded. So that's an interesting thing you could do. And I've told my kids that they can have me cremated, and what they do after that is up to them. I always told my husband I'd dig him in around the rhododendrons, but then he finally told me what he wanted. So it seemed to make it easier having done it with my parents, except that I was living in Pennsylvania and he died in a hospital in Maryland. And I have a friend who's itinerant funeral director. And he said that he would come and get the body and drive it to Pennsylvania if that's what I wanted to do, because I didn't think I could do that. But there is an organization, and I think they're in different states, called Cremation Alternatives. But if, as you say, it pollutes the air, I'll have to look into that. Cremation Alternatives would do as little or as much as you wanted. He was returned in a cardboard box, didn't have to have an urn. I carried him out here. I carried him on in a camera bag and packed the camera in my suitcase. And all told, it was under $900. Now, I don't know what it is here, but it was affordable. And it did all that was necessary. So now I'll have to reevaluate it. I'm going to read the book and put some more thought.
Your father's diligence was a gift to all of you, but also to him and your mother, because if you think it through, when you've laid that all out, you get peace of mind too, knowing that you've taken some burden off of your loved ones. So that was a beautiful thing your father did. And I love that prescription bottle idea and sending remains off around the world. That's beautiful. Well, thank you so much, Jane.
You're welcome. You're welcome.
Michael, you are next in line. Hi, Michael.
Hi, thanks. I'm a little nervous. We're actually working with a realtor right now and working on finding a place for a conservation burial ground on the peninsula. And it's a little more complicated than that because we also have the idea that rather than having a preserve that's, you know, a couple hundred acres and it's 4 hours away, we'd like to do something smaller and closer to town and have a small tiny house village of caretakers who are living on the land, working and stewarding the place, and hopefully arrange with hospice, especially volunteer hospice, Clallam County or Jefferson County, to have beds or they call it, the county here calls them satellite bedrooms. It's basically a cabin. That would be a place where somebody who was facing an immediate eviction or some kind of medical emergency or something where they could go and stay and not be facing a financial disaster if they didn't have a place to be in 24 hours, which I've heard people sometimes have. And they have to make these really major end of life decisions about, am I going to be able to stay home if I can't find care? So anyway, having caregivers around to take care of the land and the families approaching death, and actually, get together and spend some time on the place with Grandpa and walk around and figure out, where do I want to be? Do I want to be over here in the orchard, or do I want to be over here in the forest? Or so we've got this idea that we've been developing for about a year, and hopefully we'll get someplace between Port Townsend and Port Angeles, and start to make. If you know of a great parcel, or if somebody's facing sale of a parcel, a homestead, or if somebody's aware of something in the area that would just be perfect, or maybe you've walked there and thought, boy, this is the place I'd like to be buried. Well, you can be buried there, but wouldn't it be great if it was a cemetery too? So that's kind of why we're doing this, because my mom lives here, and as she says, she's not getting any younger. So I have to do this. Anyway, I'll send my name and phone number out here in the chat. And thanks for doing this book, because this book really helped get me focused on this project.
Oh, I'm so glad, and what a beautiful project you have going. That is so exciting. And as you can see here, there's a lot of interest out there.
Fingers crossed. We'd love to do it the way Clallam County does hospice, which is donations and volunteer driven, and having it so that people are not trying to make a buck, but they're trying to take care of people and not need to pay high rents and not need to pay high prices. The cremation, everything would be welcome on the site. It'd be a conservation burial ground, but the prices would be kept towards the lower end of the market. And I think over in Ocean View, they're charging $1,000 for a burial plot. So I hope after we get a place, we could do it at least for somewhere in that, $2,000 or less, not the $3,000 or $5,000 or $10,000. That's crazy. Yeah, thank you.
Well, thank you, Michael. Keep us up to date as things develop. I would love to know, and then I can share far and wide. Thank you, Michael. May, it is your turn. May in October.
Hi, my name is May. This is my first meeting, and thank you so much for having this venue. I did not read the book or know about getting the book, but I did just take care of my mom for the last year. She had dementia, and I was in the Army living in Pennsylvania, and she really wasn't good at getting good access to care. And so I retired from the Army and moved back here. And I definitely saw so many holes in the system, and the caregiving system and like just the access to equipment and just the knowledge. I felt like I was reinventing the wheel. But hospice, once the hospice is called in, then it's, a tremendous revenue, just resources and access to people. But there's this window before hospice where you're just kind of lost. So, Michael, what you were talking about sounds really incredible. And I had the benefit or the great fortune of being able to take care of my mom, who had, her own resources or, funds to pay for caregiving, which if for anybody else, if she didn't, that probably would have really broken my family and my family's assets. So I see that our society definitely is lacking so much in taking care of this aging population in this window before hospice comes in. So I did also just want to share. So the night that my mom died, hospice came in and they gave me a sheet, once the declaration was made, and that sheet had a list of funeral homes. And the hospice person, said, I can't recommend one home over the others, but these three I've had good experiences with, just something super careful like that. And so I called the first one of those the day that she died, just asked a few questions about the process. But the hospice nurse that came that night, once my mom died, dealt completely with the funeral home. And she had the foresight to tell me, hey, you probably don't want to see the body leaving. And that funeral home, took the body out, handled everything. So I didn't have to see it. And then just said, come see us in 2 to 3 days. And that's when I had the appointment with them. So the total cost for that, I can't remember exactly, but I think that it was $500, and that was for cremation. And somebody just sent out the Recompose Life website, which I'm so fascinated by from an environmental standpoint. So I looked that up quickly to see what the cost would be for that. And that runs about $7,000. So that's going to be hard to be accessible for many families, I think, but is such an amazing idea. And hopefully with more people doing it, we can get the word out and more people can do it, and they can, lower costs and, all of that. But that's all I wanted to say. Thanks for your time.
Thank you, May. And yeah, you've got insider perspective on that. And I agree with you on that gap that exists is frustrating. And thinking of the funeral homes, I was going to mention this before too. This book opened my eyes to the fact that we have the right to ask funeral homes just for the services we want. But there is this perception that we have to have them do what they do. And we actually do not. And a lot of cemeteries, if you look in the fine print, they don't all require the concrete vault. There are a lot of things I was not aware, because the funeral home industry does have a lock on all of this. And I think it was in chapter 3 of the book, I made a note. The author said the most sustainable change might come with the intersection between innovative funeral homes and conservation of the earth. And that would take open minds by all. That was something I had to make a note of, because it is, a lot of us just don't know, because the funeral homes aren't telling us. And so hopefully they'll start to want to diversify and offer us other options. But well, welcome, May. It was nice to meet you. Thank you for joining us. Marjorie.
Hello. Okay, so I want to, the discussion's been really interesting so far, but I want to talk about some issues that we've not covered yet today. And first of all, in the fall of 2017, End of Life Washington did a workshop which was held at the Squim Library. And my husband and I attended it, and it was really helpful helpful. And I have not heard End of Life Washington mentioned today. And I don't know if that's in the future, but I would certainly recommend that organization, because less than a year after we took this workshop, we had to make use of it because my husband was diagnosed with an aggressive form of cancer and ended up dying 4.5 months after his diagnosis. But there were a number of things that I wish I would have done, or that we would have done. I wish that we would have thought of following the Death with Dignity and applying for that the day that we found out that my husband's cancer had metastasized into hundreds and hundreds of tumors all over his body, and that he didn't have much longer to go. Anyway, because by the time we sort of thought about it after we were shocked, it was kind of too late. So I really want people to know that Death with Dignity is an option here in the state of Washington, but you need to really be on top of things. I did end up contacting the End of Life Washington, because there's a whole procedure you've got to follow. There's paperwork involved. There's a lag in time, and by the time there's a wait time from the beginning to the end of the process. And so I think it would be worthy of more information than what we can talk about today. But I think that would be an important topic as far as end of life choices. The other issue is that when my husband died, we had already made the arrangements and already had talked about it. He was cremated, and we chose an above ground monument in my hometown cemetery. And so it's a thicker monument, and there's a cylinder, one for him and one for me. So I am planning on being cremated, and our cremated remains are above ground, just sitting on this above ground in this monument. So it's not going into the ground. So that is what my plans are. The other thing that happened, though, is that immediately after my husband died, we had, because Washington State is a community property state, we had gone in to see a lawyer prior, and we signed the community property agreement, which is vital because it happened so fast, we did not get a will made. But because we had the community property agreement, it was an easy transfer for me. However, the attorney said, as soon as he passes away, get in and make your will, because you're going to need it since you don't have a spouse. So that's what I've done, and this may be helpful to others out there.
Absolutely, Marjorie. And Death with Dignity would be an excellent topic for an entire one of our monthly topics. There are a lot of aspects to that to consider. So thank you for that suggestion, because I happen to be working on ideas for 2023. So thank you, Marjorie. And I'm so glad that your husband was able to take advantage of that. And thank you for telling me about End of Life Washington. Another thing for me to get to know, because they've never popped up in any of my research. So I'm going to look into them. Thank you, Marjorie. All right, Carrie. Oh, go ahead and unmute your microphone. There you are.
All right, am I on?
You are.
I only see you.
Yeah, that all depends how your Zoom is set, but I see you and I think we all hear you.
Oh, good. Okay. I've really been enjoying today, and thank you so much for doing this series. I am a retired medical social worker and geriatric specialist, which has come in handy now because my husband passed away, and I was so grateful for my skill set, and I'm older now. I've done a lot working with people with advanced directives and advanced care planning, and I'm also a therapist. And I've recently had some friends ask me if I would like put on a group and support people. And what I'm hearing here also is maybe someone doesn't have someone to talk these things through with. For instance, a way to look for your values is this article that you fill out called 5 Wishes. And that really helps you and others. And so I've been pondering that. And I'm also redoing all my paperwork. So it's all very timely. And when we do things together, it makes these things easier. So I wanted to offer that just to share with people.
Thank you, Carrie.
Yeah. I'll put my number in if someone wants to call or if you want to call me.
Wonderful.
I've also worked for hospice, but anyway, I wanted to talk about the Recompose, because when I was looking into it, because I find it quite wonderful, if you move, they really only have their business local. So you've paid all this money and then you're somewhere else and you're out of luck. So that's something I've been pondering, has been keeping me from looking into it further. I absolutely love what Michael's doing. Michael, I'd love to talk to you. This is so needed and so wonderful. Anyway, I just want to thank you again for doing this, and I'm grateful.
Well, we're grateful to have you here. Thank you, Carrie. And Michael, your hand went back up. I've got about maybe 2 to 3 minutes. So go for it, Michael. I mean, 2 to 3 minutes left for you guys.
Yeah. No. I'm
There's
going to
time.
keep it brief. Yes, Carrie was just saying, I've met some great people through a group called Dying Matters Guild. And it's just a loose association of professionals and volunteers on the peninsula who are working in what I'll call death.
Oh, you got muted suddenly, Michael.
Something called a death doula, which you can get certified to be. And the folks who are doing it, like Renee, just wonderful, wonderful people. And so there's this wonderful people of this community out there, people who care and are doing this really, really essential, profound work with families. And so, yeah, they're all over the peninsula, wonderful people. And we just got to find a way to connect them with families.
Mm-hmm.
Thanks.
Yes, thank you. And Laura, you wanted to add one more thing?
Just quickly, I haven't attended any, but at the Port Angeles Senior Center, there's something called, I think it's Death Cafe, where people get together. So I wanted to put that out there, that it exists. I haven't gone yet, but.
Yes, I haven't been to one either, but I've talked to several people who have found them very informative and very helpful. So wonderful. Thank you to all of you. I love hearing everyone's thoughts and perspectives on this topic. When you first start to broach it, you feel like, ooh, but it's a beautiful part of our time here. We begin and we live on the earth, and then we transition, and to make it what you want it to be and is very beautiful. It's a very beautiful thing. So thank you to all of you for sharing. And let's see. think you all can still see my screen because I apparently never remember to unshare. So sharing all the time. Okay, so wrapping up, as I mentioned earlier, I will be sending each of you an email containing links and details for resources were mentioned today. I will try to incorporate a lot of the resources that you all shared too, and in that email. On this slide, which I saw in the chat, I'm perfectly happy to share the PowerPoint slides. I can include that in the resources email. And so on this particular slide, we have compiled a list of some online articles and books. Obviously, there are many, many more out there. But for anyone who wants to explore the topic further, we've got online resources and we have book titles that are available in the library collection. For the online articles, there are advanced care planning fact sheets at Elder Care's website. As we touched on a little bit earlier, Olympic Medical Center offers one-on-one advanced care planning consultations. You can do those by phone or in person. They may also offer them on Zoom now. And they also offer advanced care planning workshops. And then on their page, there's a link to a PDF that is a booklet that gives an overview of advanced care planning and then also includes the Washington State Advanced Directive form for designating a durable power of attorney for healthcare. And I have a little more to tell you about that in a bit too. The third item on the online resources, the Conversation Project. They have a website that provides conversation guides to take you through the advanced care planning process. And because so much of that planning is about having those conversations with your healthcare providers and with the people who are important to you. And then there are some articles from the National Institute of Health, the Centers for Disease Control, or National Institute on Aging, and the Centers for Disease Control and Prevention, and the link to the information from the U.S. Department of Veterans Affairs. They have a lot of great podcasts. You can listen to them right from their website about various issues that we cover today connected with advanced care planning, and also that values worksheet. And then we have many books, but here's a sampling of books in our collection that touch on these topics. And for any of these books, and including Our Last Best Act, if you pull them up in our catalog, which I'll be sending you those links, there's a section that will show you other books like this. And that is another great way, kind of like when you get on YouTube and then you end up going down a rabbit hole because you're seeing other videos like this. Well, you can do that with your books too. So we have The Beginner's Guide to the End, Practical Advice for Living Life and Facing Death by Bruce Miller, which presents an action plan for approaching the end of life. The author describes the book's purpose as not so much to help you die, but to free up as much life as possible until you do, which is a lot of what we've been talking about today. Putting this effort in takes that burden off your mind and allows you to live more freely. The second book, The Better End, Surviving and Dying on Your Own Terms in Today's Modern Medical World by Dan Morheim, is about 21st century medicine allowing most of us to have a say in our death. But we have to make some decisions. So this book offers real life stories, practical guidance to navigate that end of life care option. The third one, In Case You Get Hit by a Bus, my favorite title, How to Organize Your Life Now for When You're Not Around Later by Abby Schneiderman, presents a step-by-step program for getting your life in order so you're prepared for the unexpected. The Conversation, A Revolutionary Plan for End-of-Life Care by Angelo Volandes, is about re-envisioning the patient-doctor relationship and offering ways for patients and their families to talk about end-of-life treatment, to be sure that the patient is at the center of their own medical care and in charge of their medical care. And finally, Death for Beginners, your no-nonsense money-saving guide to planning for the inevitable by Karen Jones. With a bit of humor, this book offers information on the subject of planning for your death and organizing funerals. And also, for any of you that are interested, we have put together a resource packet that you can pick up from a Knowles location. It will include a booklet from the National Institute on Aging about end-of-life care. This booklet is written to caregivers and families, but it provides excellent information about advanced care planning and care decisions at the end of life. So it is still a very valuable tool if you want to start looking into advanced care planning. Also, the packet will include the advanced care planning overview with Washington's advanced directive form that I mentioned that is available through Olympic Medical Center's website. We have the published booklet with that will be in the resource packet. And then there will also be a printout of that values worksheet. So if you would like a packet of your very own, please just email me. You can get my email address, c.desmaris@knowles.org, but it's on those emails I sent you. Email me and let me know you'd like a resource packet and tell me which branch you would like to get it from. And then I will respond and let you know the date on which you can expect it to be available for pickup. Our next intentional aging will take place here in our Zoom room at 11 a.m. on Tuesday, the 15th of November. We will have a guest presenter this time around. Sarah Morrison is a fantastic librarian here at Knowles, and she is going to share details about improving our digital literacy so we can more effectively locate and identify reliable information on the internet, because that is getting harder and harder to do. So we all can sharpen our skills. She'll also share best practices for protecting your personal information online. All very important and helpful in this digital age. So that is all for today. Before we go, I want to thank you all for supporting this program, for being here, for sharing your thoughts. I love hearing everyone's perspective. You and the Knowles Friends of the Library organizations across the county make this all possible. So be safe, be well, and we will see you.
Can I ask a question quickly?
Yes.
I'm sorry. So usually to copy the chat, there's 3 little dots. But there are not 3 little dots on mine. I don't know why. Any ideas of how to save the chat, or can you save it and email it?
I can save it, and let's see. My 3 dots are down like where I would type a message. Is that where yours?
Yeah, I mean, usually that's where it is. I've saved many chats, but it's not there. There's a page and a face, and then usually 3 dots come after that, and they're not there.
Sure. Yeah, I will save it, and I will make sure that you get it. All right. All right. Thank you, Carolyn. All right. Thank you, everybody. Enjoy the sunshine. Soak it up. It's going to end sometime.
Thank you, Karina.
Thank you all. Bye-bye.
Thank
Thanks so
you.
much. Bye.
Bye.